Rotator cuff muscles. 4 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Surrounds the glenohumeral joint and glenoid cavity, and these muscles and their tendinous arches make a rotator cuff around the shoulder joint, and it stabilizes the shoulder joint and prevents its upward dislocation. And they are used in various movements of the arm, most importantly the abduction. And supraspinatus is commonly injured muscle in the rotator cuff muscles. Here is their attachments. The supraspinatus muscles arises from the medial 2/3 of the supraspinous fossa of the scapula, and it inserted in the most superior fossa on the greater tubercle of the humerus. Greater tubercle of the humerus has 3 fossets: superior fossette, middle fossette, and inferior fossette. On the superior fossette attaches the supraspinatus, on the middle fossette infraspinatus, and on the inferior part attaches the teres minor. Supraspinatus, infraspinatus, and teres minor respectively attaches on the greater tubercle fossettes. Now, infraspinatus arises from the medial 2/3 of the infraspinous fossa of the scapula, and it attaches to the intermediate or middle fossette of the greater tubercle of the humerus. Teres minor arises from the upper 2/3 of the flattened surface of the bone on the posterior surface of the scapula, just lateral to the lateral port of the scapula. From here teres minor arises, and it attaches to the inferior fossette on the inferior fossette of the greater tubercle of the humerus, which is present here, making a elbow joint. Making the shoulder joint. Here teres minor arising from the upper 2/3 of the lateral surface, from the posterior surface of the scapula, and it is being attached on the inferior fossette. In this picture, the infraspinatus muscle is cut, and below it teres minor is visible. Teres major arises on the elongated oval area on the posterior surface of the inferior angle of the scapula. At this point teres major arises, and it attaches on the medial lip of the intertubercle sulcus of the anterior surface of the humerus. Here comes the subscapularis, which arises from the medial 2/3 of the subscapular fossa on the anterior surface of the scapula, and it attaches on the lesser tubercle of the humerus. Here attaches the lesser tubercle of the humerus. Now nerve supply. Supraspinatus and infraspinatus muscles are supplied by the suprascapular nerve, and the teres major from the subscapular nerve, and teres minor is supplied by the axillary nerve. And the subscapularis is also innervated by the upper and lower subscapular nerves. All these muscles join to form the rotator cuff around the shoulder joint, but they have separate functions as well. Like supraspinatus acts and it causes initiation of the abduction of arm to 15 degree at glenohumeral joint. First 15 degree abduction is assisted with the supraspinatus muscle. If this muscle is weakened, or as it most commonly got teared in the rotator cuff injuries, then patient has difficulty in initiation of the abduction, especially in the first 15 degree. Now infraspinatus, these causes the lateral rotation of the arm at the glenohumeral joint. Teres minor also causes the lateral rotation of the arm. Infraspinatus and teres minor both causes lateral rotation, but the teres major causes the medial rotation of the arm. Initiation of the abduction, both these supraspinatus and teres minor lateral rotation, and teres major causes the medial rotation. Subscapularis along with the teres major muscle causes the medial rotation of the arm at the glenohumeral joint.